We turn to a new report recommending the province phase out for-profit healthcare staffing agencies.
The call comes as data shows Ontario hospitals spent more than $9 billion on staff from those agencies over the past decade. CTV's Allison Hurst joins us live with the details. Allison.
The study found that over a 10-year period, growth on public funds spent on private agencies outpaced that spent on public hospital staff. Ontario hospitals are under pressure, forced to spend billions to pay for private agencies, a new study finds.
The Ontario government's funding and policy decisions are responsible for a province-wide hospital funding crisis that has triggered a serious workforce crisis.
The study by the Canadian Centre for Policy Alternatives found that Ontario hospitals spent $9.2 billion on nurses and other staff from for-profit agencies between the 2013-14 year and 2022-23.
The provincial government continues to encourage for-profit involvement that is destabilizing Ontario's health system.
According to the study, during that decade, public hospital spending on staff increased by 6%, outpaced by spending on private agencies, which increased by 98%.
Why does this government continue to sell out Ontarians to private companies that just gouge our healthcare system?
The report was debated at question period.
Staffing agencies are a tool used primarily in rural and northern hospitals to avoid service disruptions. In fact, it is a tool that they have been using for decades.
The research shows while the number of hours worked by agency staff in Ontario hospitals accounted for just 0.4% of all frontline workers' hours in 2022-23, 6% of the hospital's labor costs went towards private staff.
Under the Ford government, we pay more and get less for health care,
creating a reliance on them, quite frankly, and millions of dollars of debt for hospitals.
A spokesperson for the Minister of Health says in part, since 2018, our government has registered a 100,000 record number of new nurses, and we have another 30,000 nurses currently studying at one of Ontario's colleges or universities.
Ontario has become one of the most under-capacity hospital systems in the industrialized world.
The study examined financial statements from 134 Ontario hospital corporations and data from the Canadian Institute for Health Information. The study listed several recommendations, including banning private agencies, addressing the staffing shortage, and boosting the hospital-based funds to the tune of $2 billion. Reporting live, I'm Allison Hurst. Nathan, back to you.
All right, thank you, Allison.